So, as all of the hospitals and the whole country then was challenged with the introduction of this novel SARS-CoV-2 and the global pandemic from COVID, we needed to be agile and we needed to act quickly on our feet. Not only, really being able to care for our healthcare teams, but pivoting to keep our healthcare teams safe, but still providing excellent care for our patients and our families at the bedside. So a big part of that, right, was creating new isolation units. We ended up having 5 across 2 campuses and 3 buildings. We had eager volunteers that then became obligate workforce. We've had many more patients than the 400 listed here that have received care for us, including adult patients shared among Texas Medical Center in our institution. And now, of course, we have an established track record, but we needed to really retool what we already had. And in order that gave us the agility to move quickly. So the next slide is actually, you'll recognize as the floor plan of the 17th floor, the Legacy Tower, the room 1 there and then all the way to room 24. And the colors here, you can start the video, thank you. The colors here actually show green being tested and negative, the yellow being that they were tested in the past. And if they were positive tests, patients who had positive COVID tests, they would come up bright orange. This gives you a blink of an eye situational awareness about your patient's testing status and where our positive patients are coming up. So then what's most important is if you drill down, the data lives behind the patient, you're going to see the actual live monitor at the bedside. The GE monitor data is coming up straight from the GeoMap. We can review the data immediately without being at bedside, which changed our practice because a lot of our surgical patients, we review in big crowds at the bedside. We look at the monitors and the data, but now we're able to do it actually away from the bedside, protecting our healthcare workers, but also not having to all gear up with PPE to come into the room or to review the data. So we're jumping to another patient. You can see immediately comes up with the live GE feed. And so we can then review the patient's vital signs and the immediate current status of the patient and make efficient data-driven decision-making with our surgeons, with our ancillary services, with our consultants who may not be in the room, may not be in the floor, or may not actually be even in the same building, but can give us advice and allow us to have efficient and safe